Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Cardiovascular conditions. Hypotension. The cause of hypotension is blood loss. Prevention of hypotension. Whenever there is controlled hypotension, in controlled hypotension should be done by maintaining the minimum mean and sorry we should maintain the mean arterial pressure to be between 50 to 65 millimeters of Hg, and we can do auto regulation. In controlled hypotension, the agents used in controlled hypotension are nitroglycerin can be used, but nitroglycerin has a side effect of methemoglobin, but this incidence of methemoglobinemia is very rare. Other agents like sodium nitroprusside, alpha blockers, beta blockers, or alpha plus beta blockers, or remifentanil, these can be used for maintaining the control or for inducing the controlled hypotension. Sodium nitroprusside has a toxicity which is cyanide toxicity is seen in with sodium nitroprusside. Then other cardiovascular system complications in anesthesia include hypertension. The patient can have hypertension or tachycardia. In the tachycardia, the most common tachycardia is arrhythmias. So hypertension and tachycardia can occur if there is inadequate depth of anesthesia or pain. Myocardial infarction can occur. Cardiac arrest. In cardiac arrest can be seen at 82% at induction. Causes of cardiac arrest. Ventilation failure is the most common cause of cardiac arrest. Arrhythmias like bradycardia can occur due to succinylcholine resulting in systole. Hypotension can also be a cause for cardiac arrest.
Summary: cardiovascular system complications in anesthesia. Hypotension is one of the complication. Hypotension, the most common cause of hypotension is blood loss. So prevention of hypotension is mainly by controlled hypertension. We will have to control the hypertension. The goal is to put the mean arterial pressure to 50 to 65 millimeters of Hg, which will help in auto regulation. The agents used for controlling hypertension is by nitroglycerin can be used, sodium nitroprusside, alpha blockers, beta blockers, alpha plus beta blockers can be used, and remifentanil can be used. Other complications like hypertension are seen, tachyarrhythmias are seen, tachycardia. The most common tachycardia is tachyarrhythmias. Myocardial infarction is one more complication. Then cardiac arrest is also seen in 82% of the patients. During the time of induction, we see cardiac arrest. Causes of cardiac arrest are, the most common cause is ventilation failure is the most common cause. Other causes are arrhythmias are seen, and also hypotension is also causes cardiac arrest. In the arrhythmias, bradycardia is caused by succinylcholine. Succinylcholine will result in bradycardia, and thus it might progress to asystole also.
thank you and thank you for watching.